Hello, I'm Sarah from South London Sling Library. Today I'd like to show you how to use your standard Tula carrier with a newborn baby. This requires the use of an infant insert. So what I'm going to show you how to do is put the carrier on, get the carrier ready, pop the baby in the insert, and then pop the baby in the insert in the carrier, if that makes sense. So I'm going to pop this down for now. We're going to do the carrier first. So what I'm going to do is I'm going to hold the carrier upside down by the waist belt in front of me with the outside of the carrier against my body. I'm going to tilt that waistband in towards me and I'm going to put it, for me, it works if I put it roughly around my hips. What I would say for you is if you hold your baby in the insert, we're going to put the baby in the insert in a minute, but if you were to hold your baby in the insert on your body, work out where you want them held, put the carrier just underneath the insert there, yeah? But for me, it works out just about round my hips. So I've got my carrier on round my hips, it's level front and back, so it's parallel with the floor, it's not tilting forwards or tilting backwards. What you find, the Tula has a back clip that does up at the back here. I've got tiny little T-Rex arms. I can't get that done up for love nor money. So I cheat. I do it up in front of me here where I can see it. And I make those shoulder straps nice and long just by taking that buckle, lifting that buckle. Just treat it like a rucksack buckle. So you pull it to tighten, lift the buckle to loosen. So that's the setup for my carrier. I'm now going to show you how to put your newborn baby into the infant insert and then we can put the two together. Okay, so this is my Tula infant insert. Obviously you can do this on a sofa or on your lap or on a nappy changing table or whatever is most convenient for you. All I'm going to do is undo the Velcro straps to undo that harness. Then I need my baby. So this is Jamie. Jamie is my newborn size demo doll. All I'm going to do is lay Jamie on this insert so that his bottom is in the back there. So just like that. So Jamie's bottom is in the back of the insert and their feet just like that. I mean, it's kind of easier with a real baby. Then I'm going to take the harness, bring the harness back up over Jamie, and I'm just going to slightly roll the insert so that I can stick those Velcro straps back down. And that's Jamie safely in the insert. Then all we're going to do is put Jamie and the insert in the carrier. Okay, so we're back. So here I have Jamie in the infant insert. I've got my carrier on just kind of around about my hips, and you can see that if I hug Jamie into my body in the infant insert, just the way I would naturally if I were holding them in my arms, that the bottom of that carrier, the bottom of the insert rests kind of on the waistband of the carrier. Jamie's little feet are kind of just about poking out either side, yeah? And that's absolutely fine. Hands up by baby's face. It's generally where newborns want their hands. Just hug them in like that. Then all I'm going to do is pop a hand under the body panel of the carrier, pull it slightly out and up the back of the infant insert. Smooth it up. So now all I'm doing is holding Jamie, the insert and the carrier, all in exactly the same position. I can then get my back clip that I did up earlier because of my tiny little T-Rex arms. I can just take that, chuck that over my head and slide my hands in like a jumper. And then to get the whole thing tightened so I can then be hands-free, I'm going to hold on to that webbing where it joins the body panel, follow it backwards, and I can find the little bit of that strap that's hanging down. I can then pull that down and forwards. I'm going to let go, do the same on the other side. There it is. Down and forwards. Going to go back to the first one just to even them up. Down and forwards. Down and forwards. Then I get to a stage where I feel like I can let go. I'm just going to hold both my straps, pull them out. I've got one slightly longer than the other. I'm going to loosen that one, tighten that one, just to make sure that my carrier is symmetrical on my body. It's not going to pull over to one side. I've got the padding tucked up there, so I can just untuck that. That's better. But it just makes it symmetrical on my body, so it's not going to be pulling to one side. So they're roughly the same length. That'll do. I'm happy with that. Now, never underestimate the power of a perfect fit adjuster. These little straps at the shoulders are called perfect fit adjusters, and particularly for those of us who are a little bit more petite than some, just getting hold of that perfect fit adjuster and pulling down towards the floor can help to snug everything in, and it can make a massive difference to stopping the weight pulling away from you. Ideally, I don't want the carrier coming any higher than the nape of the baby's neck. So before I do those perfect fit adjusters up, I'm just going to get hold of that infant insert, fold it over and just tuck it inside there. There you go. What I've done there is it just coming up to the nape of baby's neck. I can fold the outside of the carrier over and then I can do my perfect fit adjusters. And I just feel a bit more confident that it's easier to see my baby. And so I feel like I can monitor their airways a little bit better. I've got feet just poking out at the sides here. Some babies will have their feet very tucked up and their feet will be inside. That's absolutely fine as long as they're not putting pressure on them. If their feet are tucked or inside and they're squashed between you and the carrier, then that's not ideal. So just make sure their feet are free. If they pull them inside the carrier, that's absolutely fine. If they're just poking out, that's also absolutely fine. So the safety guidelines to remember in any sling or baby carrier, the word is ticks. You want to be able to tick all of your safety boxes. So the T stands for tight. The baby is as tightly held against you as if you were holding them in your arms. So you should be able to pop a hand on the back of the baby's head, do a little dip forward and not feel their body weight pull away from you. The I is that baby's face is in view, not covered by fabric. We've folded down the insert so I can see the baby very clearly. It's very easy to monitor their airways. The C is for close enough to kiss. You should just be able to dip your head and kiss the baby. It's for those of us with breasts, it's about having the baby nice and high on your chest, above your breasts, so they're not at risk of closing an airway against a nice soft squishy surface. The K is keeping the baby's chin off their chest. The easiest way to make sure that the baby's chin is off their chest is to do the ugly double chin maneuver and make sure you can see the top half of the baby's face. And as long as you can see the top half of their face, their chin is off their chest. The S is supported spine. So if you put a hand on the baby's back and lightly press, they shouldn't have extra room to get closer to you or uncurl or sit up. And it's about not allowing them space that they could slump into, put their chin on their chest and close their airway. The great thing about the standard Tula is that as your baby gets bigger, you can stop using the insert. The carrier will fit babies it will depend obviously on your baby, but generally from anywhere between sort of 6 to 8 months without the insert. And then, it will go on until they're kind of beyond 2. It's quite a really well-lived carrier. To take the carrier off, because I've slid that strap nice and low on my shoulder straps, I can reach it like a bra strap and just undo it and slip my shoulders out. As your baby gets bigger, so I could then take my baby out with the insert. As your baby gets bigger and you want to stop using the insert or you're not sure, take your insert apart. You can just use this section. So if your baby doesn't need to be nice and cocooned anymore, as they get older, they tend to fight against that, but they just need a boost. So if you look at, if I get one of my mid-sized babies, oh, Frankie. Typically the baby you want is in the bottom of the bucket. So this is Frankie. And if I hold Frankie, I might think that Frankie's too big for the insert. But if I hold Frankie on my front and put the carrier up over his back, what you can see is that the edge of the carrier goes way past his knee pit and straightens his leg out. He can't bend his leg over the side of that carrier, and having his leg forced out in front of him would just be uncomfortable. He's got his knee over the edge of that side, but on this side it's forcing his leg out. And even if I try and get him in the middle, it then just forces his leg out on both sides. He wouldn't be comfortable. Whereas if I get the cushion from the infant insert, get it under his bottom, there you go, that lifts him up and allows him to bend his leg over the edge of that cushion. I can then put the carrier up over him. And I can't get that clip done up because I didn't do my chest clip trick. But if you imagine that's done up, you can see that just having that boost allows him to bend his knee over the edge of the carrier. And that will then mean that I can use this until he's tall enough to sit in that carrier with it comfortably in his knee pits. So do remember, you can take your infant insert apart and just use the cushion section for that mid-age range. Once Frankie's old enough to sit in the carrier, without that, I wouldn't need it anymore. So I hope that helps. If you need any information about South London Sling Library, how we're working at the moment, or the slings and carriers that we've got available for hire, you can find all of that information at southlondonslings.co.uk. I hope that helps, and I'll see you soon. Thanks a lot. Bye.